Hi, my name is Stacey McConnell. I'm a physical therapist at St. Elizabeth Sports Medicine, and you are on the run. Today on the run, we're talking about how to recognize injury earlier rather than later. We're joined for this video by Dr. Michael J. Miller. He is a primary care sports medicine physician and has been the medical director of St. Elizabeth Sports Medicine from its inception from 1988 till now. So, Dr. Miller, thanks for being on this video.
Well, thanks for inviting me. I'm excited to be here.
Okay. Well, you know, we have conversations about patients, about runners, and some of the conversations go like, boy, I wish they would have come in a little sooner so we could have helped them sooner and they could have stayed with their running and then reached their goal. For those distance runners that are training right now, they're starting to get their mileage up, they've got an event that they're looking forward to. How would you help them recognize maybe some of the differences between normal training effect, soreness from that, and then something that might be an injury starting up for them?
That's a very pertinent question, and I thought just right at the beginning I would mention when we talk about injuries with running, most of the time we're referring to overuse injuries. And an overuse injury is the type of injury that comes on real gradual over time and is really related to that repetitive micro-trauma, that day after day after day after day. I kind of have a good pain, bad pain discussion that I've used for many years, and it kind of goes something like this. If I am at the beginning of a training and I go to my practice or my training and I have a little bit of soreness, and the more I warm up and stretch well, and the more I train, the harder I work, the better I feel.
Right.
It starts to loosen up. I'm having fun. Mm-hmm. My performance is pretty normal for me. I'm not limping. Right. But when I get done with my workout, I'm a little bit sore. That's probably what I call an okay pain. I think you can typically just kind of work with that, maybe modify a little bit, give it a little time. I think that sounds like something that'll probably work its way out. The bad pain is you show up to condition and you warm up and stretch and you have a discomfort, and the more I work out, the worse I get. Right. And now I'm not having a lot of fun. Right. Kind of focused on it. My performance is less than usual.
You're starting to worry about it.
Yeah.
Right.
You're not having fun because you're focused on it. Maybe your gait and you're gimpy and you're limping a little bit. Right. That's the kind of pain that I would suggest you don't work through, because that's kind of suggestive that maybe you're getting in a little bit of trouble.
Now, some runners are very reluctant to come in. I think they're afraid of seeing a physician that's going to say they're crazy or stop running. You don't have any other really good, positive information, like the physician might say or the therapist might say, well, why don't you just stop running? And that's not something that sits very well with a runner because of all the benefits running brings to them, and how how seriously they take their running. They don't want somebody to just blow them off and say, your running's unimportant. If a runner does come into you, what are some of the things you'll tell a runner who's hurt? What are some of the things you'll do for a runner?
Well, I love that question because the benefits of running and aerobic exercise far outweigh the negatives. Mm-hmm. So I think as a sports medicine physician, I'm going to look for ways to keep you active.
Right.
We might have to modify. We might have to decrease the frequency of your runs, the intensity, the duration of your runs. Sometimes, if you wait a little too long and you get in a little bit of trouble, sometimes we have to completely stop running. But we'll start being creative and look for other ways to get your conditioning. We can cross-train in the water. We can get on a bike. Sometimes walking is okay, but running's not. Right. So we're going to, I can't think of too many times when I'm going to tell somebody to go sit in a chair and pick their nose for 6 weeks.
Right.
We're going to continue to try to keep them active. And I think, Stacey, you bring up, I think, a key point is we can treat these better with less rest and develop a plan that interrupts your training a lot less if we catch you early.
Right.
So that's the incentive. If you're struggling, get in early. We can jump right on it, catch it before you get in trouble, and you won't miss much conditioning or training at all.
Well, I want to thank Dr. Miller for coming in today, and I'm probably not going to recap this because there's just still such a lot of good information in there. But hopefully this segment will help you recognize injury early, and if you're unsuccessful taking care of it, you will go ahead and schedule with your physician or with Dr. Miller on the early side so that we can help keep you running and reach your goals. Thanks, Dr. Miller.
Thank you, Stacey.